All right, so first visit today, chiropractic, right? Never been to a chiropractor. No. So your symptoms are like belt-like back pain for how many years now?
About for the past 4 or 5 years.
4 or 5 years. You had radio frequency.
Yes.
No chiropractic adjustments give you benefit. And so today it's like 7 out of 10?
Yes.
All right, let's go face down on your stomach. So after doing your postural evaluation, your head's really translated forward. There's a lot of pressure in the lower back. So we're going to start with the leg check. You've seen this, right? Okay, so we're going to start with the leg check. You got a right short leg. I'm going to bend in the flexion. Does this bug your knees or not really?
No, it's fine.
How about the back?
No, it doesn't bother me.
So his right leg is short and stays short. So you said L5, S1 discectomy.
Yes.
The reason you had it is because you had what, leg pain or no leg pain at all?
I had 2 bulging discs that were touching the nerves.
Right. Okay, so this adjustment, you've seen the video, is a lot more aggressive than traditional, but that's sometimes what you need. All right, so we're going to start adjusting right now. You ready? Yeah. All right. So we're going to start with the drop technique. But before I do that, I just want to do some distraction on his lumbar spine. Okay. So this is called the Cox technique. I'm sure you've seen some videos of this. It's a form of decompression. You see how I'm pulling right about there?
Yeah.
Does this hurt? Does it feel good?
No, it feels good.
Okay, good. So Dr. Cox recently passed away. He was the pioneer. Oh, there we go. I felt that little release there?
Yep.
So he was the pioneer with disc care and developed this table and technique. Being that he's never been to a chiropractor before, I think it's good to gauge and see how he's going to do. So none of this was ever done, right?
No.
Okay, good. All right, now we're going to go into the drop. Okay, so table's going to pop up. It's going to pop back down. Breathe in and let it out. 1, 2, 3. You okay with that? So I'm just going to go drop 5. Sorry. 3. Good. Breathe in. Out. Out. Bend your knees. There we go. Felt that release?
Yeah.
Damn. Breathe in and we'll let your air out. Beautiful. You okay with that?
Yeah.
Now this is a little more complicated. Drop. There we go. Woof. That was good. Now flip over, lay on your back. So you're going to decompress this lower part of your body. Let me have this. Okay, good. Take a deep breath in and let your air out. Drop this. You're okay with that?
Yeah.
Good. Breathe in and let it out. Drop it. That was good. Drop. Now sit up facing the side. Get your shoulders. Okay, elbow, bend this. There we go. The microphone picked that one up. It was right in the mic. Good. Click, clicks. Now comes the fun part. Perfect, yep. Maybe slide down a little bit. That's good. Lay back. And I'll talk, before I do anything, I want to explain to you what I'm doing, so I'm just not going to do it. All right, so this piece will come up. Bend your knees. It'll allow you to have your lower spine flat. So relax your legs. Yeah, just relax that. Good. Okay. He is, guy. Got him. All right, so the hips are right here. Slide down a little bit more down, this way, down. So these will be right on top. That's it. These will be right on top of your hips. It's not supposed to be comfortable. As soon as I do the pull, I'll take the pins out right away. And let your air all the way out. That's in there tight. You're not going anywhere, right?
No.
Okay, great. Rest your fingers here. I find it better when you close your eyes because the light in this room is bright. And you're going to breathe in and out through the nose. And I'll pull when I think it's ready. But listen to what I have. I'm going to give you a very simple instruction. You probably know what I'm going to do already, but I'm going to probably change it up. Take a breath in. So it's going to be from here, okay? Breathe in and out. Breathe in and out. Wiggle your toes. Wiggle them. That was okay. Not too scary?
No.
You okay?
Yeah.
Where'd you feel that mostly?
In the lower.
Okay, in the lower. There we go. Stay right there. Beautiful. Take a nice deep breath in. Relax your head. Don't help drop this head down. You're holding on to that drop. There's no way. Wiggle those toes. That's it. You're stiff. And now push yourself up to a seated position. Like push yourself, swing your legs off the table. Stand up. What's different, if anything's different?
I feel less inflammation in the lower.
Around the belt where you're talking about?
Yeah.
Okay, cool.
Right here.
All right, good. Stay right there. Stand up straight. Good. And again, so you said today was like a 7 out of 10. I want you to walk down the hall. I want you to feel like your posture and see what's different, because one visit can be pretty impactful, but you're close by. So this protocol usually want to see you 4 to 6 times over a couple weeks. So it's not one and I fixed 20 years of back problems. It doesn't work that way. So today's what, Tuesday? Come back next week, maybe next Tuesday. Chest out, shoulders back, head back. You're gonna really jam that in there. No one's ever done this technique either.
Yeah.
And you're okay with it, right?
Yeah.
Okay, walk down the hall and walk back. You wanna see the before and after? I'll be right in there, okay? Do a little more instrument work with him? Okay.
Alright, here we go. Nice deep breaths in. Where you mainly get the pain? Low back?
Yeah, the lower.
Gotcha. Got the Air Jordans, nice. Just take a lot of pressure off that low back. Alright, nice deep breath. Oh, it's gonna be a little intense. Deep breaths. Nice deep breaths, bud. Right side. Gotcha. Maybe relax this arm right here. It's gonna be a little intense. So. Nice. Alright, but I'm gonna have you turn onto your back. Just relax it there. Okay, with this arm, you're gonna try and reach over your head like that and then come back, okay? Breathe on out. Breathe all the way out. Doing okay? That's like one of the most intense things I know, so.
What's different?
Less inflammation down here.
Less pain?
Yeah.
Better, what else? Mobility, flexibility?
Flexibility.
Try sitting. Because usually going in and out of a chair is what pisses people's backs off often. Different? So you'll be back probably next week. Yeah, so tuck it, it's called chin tuck. So now do it. Yeah, like that. Do it 10 or 12 times, really slow and controlled, hold it. So to turn these back on every day, that's your homework.
Okay.
All right? Hey guys, so this is an interesting one. The patient has been dealing with lower back pain on and off for years. He recently had surgery, microdiscectomy at L5, S1, L4, L5. He had some radio frequency, and it was recommended to him that he see a chiropractor. He's never seen a chiropractor before, and what really spoke to him is the Y-axis manual spinal decompression, also known as the ring dinger technique. He found me on Instagram. He came in after looking at his posture, doing an examination, determining that he was an appropriate candidate for the technique. We started with our full body chiropractic adjustment, utilizing a drop technique, utilizing some Cox flexion distraction technique. Then we did a full body adjustment, followed by the Y-axis manual spinal decompression pull. Then we did an arthrostim, which is an instrument adjusting tool that we utilize to help stimulate mechanoreceptors and proprioceptors and retrain the body. Then Dr. Kors did some myofascial technique on trigger points throughout his body. And then we also threw in some home care because he needed to do some home care. So there's a lot more to our practice than just a crack, see you later. We'll look at your posture. We'll take an x-ray if needed. We have x-rays on site. So when they're indicated, we take them. Sometimes it's not safe to adjust people without looking at their x-ray and doing a proper evaluation and exam. So that's what you're getting here at NoHo Chiropractic. Next year will be 30 years of working in the area. So a lot of experience, a lot of skill, and a lot of techniques that other people don't have, to be quite honest with you, like cold laser therapy, class 4 hot laser therapy, PEMF technology. We also utilize hyperbaric oxygen therapy and spinal decompression. So there's a lot of tools that we have at our disposal. So if you're watching this video and you're thinking that you might need to come in, we're here for you. We'll see you in the next video.